Health Minister highlights strides in healthcare delivery through investments in digital infrastructure. The Minister of Health, Dr. Okoe Boye, today gave an account on the health sector and outlined investments the government has made in infrastructure and digital platform to improve healthcare delivery across the country. The minister noted that most hospitals in Ghana are now interconnected with the deployment of advanced IT-enabled systems which have streamlined patient care and enhanced data management. He was speaking at a press briefing organized by the Ministry of Information in Accra.
If you are transferred from Central Regional Hospital to Kolebu Teaching Hospital, you don't carry a folder, you just have to give your ID number and the system has all your data. Dr. Okoe Boye explained while underscoring how the innovation has significantly improved healthcare access and delivery. Dr. Okoe Boye also cited the National e-Health Project, which serves as a real-time health surveillance system and helps medical authorities identify disease outbreaks promptly. He emphasized that under the current administration, hospitals have received technological upgrades, including networking infrastructure, laptops, and tablets for healthcare professionals.
Ghana has most of its hospitals now connected through an IT system that allows data and history or information of patients to be taken and put on computers and laptops instead of to be written in folders. And we all have had the occasion to be in government hospitals before, prior to the Akufo-Addo administration, where sometimes you have to wait for more hours to access your folder than it takes you to see the doctor. In Kolebu now, sometimes when we say these things, people assume it's happening in small hospitals. In Kolebu Teaching Hospitals, nobody takes your history with a pen and paper anymore. All your data is on a computer. And by the time you get to the lab man has it on the computer. By the time you get to the theater, your information is on the computer. By the time you get to the ward, the nurse has a tablet that has all your data. And so we have done a significant job to network these hospitals. And if you are transferred from Central Regional Hospital to Kolebu, Teaching Hospital, you don't carry a folder. You just have to give your ID number and the system has all your data. And this has helped a lot to improve access to the doctor and health delivery. So this project has the objectives of optimizing the business process to enhance cost saving, improve systems, and to harmonize them, and to allow hospitals to talk to each other. It's very, very important. So the project scope, each facility is provided with the following infrastructure: networking, that's a local area networking at each facility, and wide area network, hardware. So we've given to the hospital servers, desktop computers, laptops, and tablets. And the LHIMS refers to the Light Wave Health Information Management System. It is this that we refer to as the e-health project. It comes with training as well. And it is refreshing to know that 99.8% of hospital-level facilities are now operational. 451 sites are actively using this system. Over 20.8 million patients have been registered, and 47.8 million patient visits recorded. And this system also allows the hospitals to track their revenues and to avoid some of the revenue losses. So cost savings, the benefits, efficiency gains, availability of real-time data. The good thing is that this system also comes with surveillance. So in Ghana this morning, if across the country, out of, let's say, 50,000 visits, 40,000 are realized to have had signs and symptoms that look similar and point to a particular disease, immediately it's a red flag. And real time, the Ministry of Health, and for that matter, Ghana Health Service, can immediately tell that something is happening in the country and we can move to address it promptly. Unlike in the past, where the one sitting at Chebi Government Hospital and the one at Sola District Hospital are not talking to each other. So we can have a serious health threat and we don't know that something is happening. So these are some of the advantages also with the e-health system.
He further reiterated that the digital transformation extends to the National Health Insurance Scheme through the My NHIS app, which allows citizens to register for health insurance using their Ghana cards and mobile payment options.
Until this government came, you cannot, as a first-timer, get onto the National Health Insurance Scheme. You have to go to a fiscal office, queue, see a manager or a worker before you are put on the scheme. Now, with the help of the Ghana card, if you download My NHIS app, which you can do now on your phone, it gives you the option to input your Ghana card details, pay using Momo, and in the comfort of your room, if you get a message that gives you a digital NHIS card with your Ghana card picture and all your details right on it, you don't need to go to anybody. And if you are 70 and above, instantly you can walk to a hospital and get care without paying 1 Ghana cedis for adults.
Dr. Okoe Boye further indicated that with the introduction of drone centers, blood and other essential medicines could be delivered to remote areas to ensure universal access to healthcare. He commended the introduction of subsidies for dialysis treatment and the government's commitment to supporting patients with childhood cancers, mental health conditions, and other serious health challenges.
Zipline. And when it comes to supply of logistics using drones, again, this is one of the classical examples where when my man says it is possible, it is really possible. Some few years ago, we were told that it's possible to have medicine you need. I worked in Chebi Hospital, so I like to use Chebi. It's possible to have a medicine you need to give to a pregnant woman who is bleeding, can be dropped in the hospital compound using a drone. A few years ago, some said it's very difficult. In Ghana, I think it's a challenge. But as we speak, it's so sad, let me use it in terms, that for us in Accra, because we have roads and other logistics, they don't drop hospital, drugs at Reach Hospital. But when you go just outside Accra, most facilities in corners where it takes an hour or two for a vehicle to get to them, when they need medicine, they call the Zipline Logistics Center. I need oxytocin. I want to inject a woman. And within 10-15 minutes, they drop the drug in your compound and the nurse goes to pick it up. In the absence of this Zipline drone technology, either you put the patient in an ambulance from Chebi to go to the Koforidua Hospital, or you put the woman in an ambulance to be driven to Nkoko or Nsawam Government Hospital. Ladies and gentlemen, we are making progress. From President Rawlings' time, since we started the Fourth Republic, till President Akufo-Addo came, any and every Ghanaian who had kidney disease in the past paid for himself or herself until they either passed away and left us, or whilst they are here in this country. Advocacy is good. With the help of the media, civil society, all of us, we've thrown light on the challenge of kidney patients. And I'm happy that this government, typical of its nature as a listening government, as we speak now, all kidney patients in this country who are 18 years or below, 60 years or above, when they go for dialysis, all their dialysis is paid for by this particular government through the National Health Insurance Scheme. And there's another bit which the NHIS has not communicated well. The average kidney patient receives about 4 sessions a month. All these 4 sessions are being paid for by NHIS for those 18 years below and those 60 and above. For those in between, currently, the NHIS is paying for 2 sessions out of the 4 sessions. And so it means that every kidney patient has received either full reimbursement or support or some subsidy from this government. It's the first time since the Fourth Republic that the government has intervened or gotten involved with paying for kidney care in this country. It's the first time. It's not only kidney care. If you have a relative who has sickle cell, you can ask them about hydroxyurea. This is a very important medicine that helps sickle cell patients to live a life which is close to those of us who don't have sickle cell. That medicine helps them to have less crisis events. Crisis means they have severe pain, they can't go to work. Sometimes it's hell for them. This medicine, through GOG, government direct engagement with the manufacturer of this drug, settled on an amount that will be paid for. And since the past 5 or 6 years, if my memory serves me right, government has been reimbursing for hydroxyurea. It was not paid for before we came. And as for childhood cancers, I think most of you know what this government has done. Because I was at NHIS, I can also say that for the first time since we entered the Fourth Republic, government has taken steps. Let me take this opportunity to encourage the board of the NHIS to quickly move to make it a reality. Whilst I was at NHIS, our team that looks at benefits and how to codify them, to look at how much we pay for, has codified the 4, I think, most common mental health conditions in Ghana, including bipolar, depression, and I think schizophrenia. So that for the first time, when we visit the hospital with these mental health conditions, the state will pay for these conditions.
Thank you for watching. For more news, please visit our website graphic.com.gh and follow us on social media. Our handles are Graphic Online Ghana on TikTok, Daily Graphic Ghana on Facebook and Instagram, and Graphic GH on YouTube and X. I am Mirab Nakoba.